and we're back. We have with us to have a discussion surrounding Cancer Awareness Month. We have in studio with us Ms. Laura Tucker Longsworth, and she is the president of the Belize Cancer Society. We also have with us, joining us via Zoom, we have Nurse Dellone Pascascio, and she is the CEO of the Dangriga Cancer Center, and we have cancer patient Chelsea Munoz also joining us via Zoom. So a host of women. Good morning, ladies. Good morning to you
Good
all.
morning. It's a pleasure to be here.
Yes.
And we have a guy in our midst, so we're off to a good start this morning.
We'll let him handle it.
All right. So, Ms. Longsworth, Cancer Awareness Month, how significant is this to the Belize Cancer Society? We know that we're in a pandemic, and I could imagine how this adds some strain to the work of the Cancer Society.
Indeed.
And the challenges that this perhaps also brings to cancer patients in seeking help.
Yes, and I like that you said that, because really at the core and center of everything that we talk about and we do are our patients, those persons who need us desperately. Well, historically, October has been our month, the Belize Cancer Society. Historically, we chose October. In fact, our founder, Juliet Sobranis, was a breast cancer patient, and she is the founder of the Belize Cancer Society. And so October was the month, and she died in October. So we always think about her and all her good work. And even now, the Cancer Society, we normally have a breast cancer walk. And we started out in October, but it rained so much. We had to shift to May, and it still rains. But anyhow, and so we have kept October of our organization as Breast Cancer Awareness Month. And so October is our pink month. Pink in every way. Our guys say, what happened to blue? But that's all right. The Prime Minister and Excellency Briceño has taken on that aspect, and that's wonderful for them to be stepping out. I think that's a really important step. So, and so the Belize Cancer Society, in recognition of the serious problem with cancer in the country, we have continued to work throughout the pandemic. And you can see where that would mean that we have grave difficulties with fundraising. We have to say thank you to those donors who responded to letters.
Yes.
Patients, as Dellone will highlight, continue to be seen at the Dangriga Cancer Center, the Belize Cancer Society, the oncology unit at Carl Huschner, and all over. We at the Belize Cancer Society have been doing patient navigation to out-of-country care, both for adults and for children. We have been very busy. And what did that entail? Working with the Ministry of Foreign Affairs, working with the Ministry of Health, and working with immigration to get our people across the border to treatment out of country and back. Thankfully, and you'll hear a little bit more, we've had to innovate. And so a lot of that, we found ways of giving children treatment in Belize rather than sending them abroad. And now that's a wonderful thing that has happened. We don't have to do that anymore. Just
to bring Nurse Pascascio into the conversation, CEO, you play such a critical role in the Dangriga Cancer Center, plays such a critical role in offering treatment to cancer patients. Have you guys, what sort of uptake have you seen in receiving and the admission of cancer patients to the center, considering the pandemic and even the restrictions with the borders opening?
Well, that's a very interesting question, and it was one that really was concerning to us initially when patients were unable to get to their providers across the border. For those individuals that we did not see before, but they were in treatment and could not essentially continue their treatment because of the limitations of crossing the border.
Right.
So we absorbed a number of those patients, not only for the provision of medication, but the provision of oncology services in total. I would say that because of that level of continuity, many of our patients did not have to have delays in their treatment, and therefore they successfully finished their treatment. And unfortunately, some of the limitations had really to do with that if they were prescribed the radiation portion of their treatment. But essentially, there was no interruption in their care. And as Laura indicated a little earlier, we had to absorb and assume care for a number of pediatric patients who got caught in the border closure, and we were very concerned because the little ones are even more sensitive to delay in care, particularly because of the nature of the treatment regimen that they were receiving. So to answer your question, we have seen an interesting uptake, but thankfully that uptake is shared between the oncology unit at the Carl Hushen Memorial Hospital and the Dangriga Cancer Center. And essentially, Dr. Yakab would refer a patient that he thought we needed to see, and we would refer a patient that would require higher level of care. So that has worked rather well. It is not sustainable over time. We have to deal with, how do we move forward, particularly because we are still in a pandemic.
Yes.
And we have to plan for what will happen if the pandemic continues, and if we are not able to kind of curb the spread of the disease, because it puts our cancer patients, both adult and children, at greater risk.
That's right.
Just to bring Chelsea into the conversation now a bit, if you would, Chelsea, for those of us who may not know, just to share a bit about your journey with cancer.
Thank you. So I shared my story a couple years ago on the same show, but on December 16, 2018, I was diagnosed with stage 2A Hodgkin's lymphoma. So for those of you that don't know what that is, it falls under the same umbrella as leukemia. It is a blood cancer. So I had a lump on the side of my neck that was very alarming. And that made me go to the doctor and get checked. I didn't even know about lymphoma before that day. So now that was like where it all began. I had to travel to Merida every other week to get treated. Wow. I had to do 12 sessions of chemotherapy that came with a lot of side effects and unimaginable pain, of course. But even though I had to go through all of that, which I think would have definitely been the toughest challenge in my life, I still pushed through it. And having a great support system, like my family and my community in the island, they supported me so much, people from San Pedro. And I think that really pushed me and helped me. And I also think that groups like the Cancer Society and doing cancer awareness campaigns like the ones I participated in make a positive impact in the lives of those that are fighting this sickness. And it did for me.
Yeah.
Nice.
And I think that, it's so important what you have shared with us in the past and even today. You are a young cancer survivor, so a really important reminder that cancer affects people of all ages, and that with proper treatment, people can still live a good quality of life and live their life to their full potential. The challenge for us has always consistently been access to treatment, affordability of treatment, and I want to pose that question now. Just it seems to me that there are more persons being diagnosed with cancer in this country than we're able to treat.
Well, I think you can look at it both ways.
Okay.
In terms of a public health perspective, it could be that we have improved our detection services.
True.
And so you always have to look at what what services are available to us as a population.
Yes.
And that's a good thing for us if that is, because there indeed our diagnostic capacities have increased. You have more personnel, similar to the Belize Cancer Center Dangriga, who developed a service out of need.
Yes.
You have within the public and private sector services being established because of need. And so people are now coming forward for detection and so on. But we still have a problem though. One, we don't have a national program that's consistent and launched with protocols that we can all, at least with care services or packages that we can access.
Yeah.
And secondly, the countries, low resource countries, or patients are the ones that get very sick and die.
Yeah.
Because you mentioned access.
Yes.
There's access. Some people can say, oh, access, okay, so we have mammograms.
Yeah.
But do you have access? And so there's a difference. So WHO
Having it in country
right
and being
is different.
able to get it.
Right, it's beautiful, but then you have to have true access.
Yeah.
And so that means that if you need a mammogram, if you need a pap, if you need a colposcopy, whatever it is you need, you have to have access.
Yeah.
Because that is what's going to reduce morbidities or sickness
Yeah.
and our late stage diagnosis. Because, and Dellone will speak to that, because a lot of our patients that come to us are in late stage
stages.
cancer. And that's why our mortality rates are going up, our morbidities increase, and people are in trouble. And we have to remember, Belize is a country, I mean, our people are poor.
Yes.
And so while some of us will be able to source finances to do certain things, others will not. And others will have to choose between their families and themselves, and then what? They die. And our people with cancer, breast cancer, cervical cancer, we have people in their 20s coming to us with late stage cancers. We now have a phenomenon that's seen throughout the region. The Caribbean, and Belize is no exception, where we have younger women with breast cancer in their 30s. So what is the protocol in terms of screening? Those are the things we need to have.
Yeah.
And very importantly, we must use the data that we're collecting better. We have to be able to analyze our data and share it so that we can do whether it's interventions, targeted interventions, and so on. So that is exactly what the issue is, having access to cancer care.
Yes.
As a human right, by the way.
Yes, I do appreciate that. And let's not forget to mention one of the most important facts that you've stated, which is the prevalence of breast and cervical cancer, which are treatable and can be detected early as well.
Yes.
Dellone, I'm sure you have so many stories you can share of people who've come in with late stage because they haven't been screened.
She's passionate about that, yes.
Yes. Tragically, this is true. Dr. Yakaba and I were having a conversation earlier, and we both noted that the age range for breast cancer has dropped significantly to where we are seeing really serious cases between the age ranges of 25 and 50 or 55. And these are not necessarily cases that are of the lower stages. We're talking about stage 3 and stage 4 cancers. You have a patient that walks in and say, I have this lump, and you open the clothing and you see this fulminating lesion on the chest. and you ask the question, how long has it been there?
Forever.
And the answer would be, well, I've had it for a while.
Wow.
I would say that a while would be a year or so, if not more. And that patient has probably been struggling with, what am I supposed to do? What am I seeing? Laura mentioned something, because I'll tell you, for us, we're kind of on the tail end of this cancer treatment spectrum. You know, we're kind of the tail of the donkey, if you will. The continuum of cancer care begins with prevention.
Yeah.
Yes.
There we go.
And it would be our absolute joy that we did not see any cancer patient for treatment, because it means that our prevention mechanism is working efficiently.
Yes.
And I want to get Chelsea's perspective here as a cancer survivor. Chelsea, you are so young, and I know that it had to be such a traumatizing experience to consider that you could have been robbed of your life by cancer if you didn't have access to treatment. How do you use this experience to educate others about being aware of screening options and being proactive about seeking out a proper diagnosis?
Good question. Yes, at first, like I said, I didn't even know about Hodgkin's lymphoma before I got diagnosed with it.
Yeah.
I saw a lump on the side of my neck, and my first instinct was to try to figure it out on my own,
Yes.
instead of going to the doctor to check it out. So I believe that a lot of people, when they see like unusual stuff like on their body, things that, you know, that are alarming, their first instinct is to, okay, let me try to figure it out myself. Which I think that if I had waited longer, then I probably would have had a harder chance to fight this sickness. So because I had gone to the doctor sooner, and I was diagnosed sooner, I had a better chance at fighting this disease. So I think that, yes, being aware of your body is really important, and not taking it lightly. And especially now, more than ever, like younger people are getting diagnosed every day. 18-year-olds, 19-year-olds. A lot of young people in Belize have reached out to me asking for advice, asking, like seeking, you know, where do we go now? Because they have been diagnosed with cancer, or there are weird symptoms, like they're experiencing pain. So I try to encourage younger people and older people to don't take those things lightly, to go and get checked. And there's a lot of like preventative like measures you can take. For instance, like with your health, I think that plays a big role. What you eat, what you put into your body, even like stop smoking, avoid secondhand smoking, because some people are like, oh, I don't smoke, but they're still secondhand smoking.
They're exposed, yes.
They are exposed. Limit your alcohol intake, and just get screened. Doing yearly checkups.
Love it.
Even if you don't see anything on your body, just still going and taking that extra care to know what is happening in your body.
I love it. I just love that response. I just absolutely love that response, because it starts with wellness.
Yes.
It starts with wellness, and you know, the Cancer Society has constantly been addressing issues of nutrition in children, banning of sugar-sweetened drinks, and so on. But indeed, she's right. We have to watch our harmful use of alcohol, reduction of tobacco, but even now, another risk factor that is quite prominent is environmental issues, environmental contaminants in the air within your surroundings, or mental health.
And the one we don't like talking about, obesity.
Yeah.
The World Health Organization has in fact confirmed that obesity, which in Belize, 2/3 of our country at the last in data is either overweight or obese. And that is actually
Yeah.
one of the contributing factors,
Yes.
to cancer.
Well, you know, Belize is higher than the region in terms of obesity rate for women. Like,
Wow.
so it's higher. So it's a problem.
Yeah.
And so obesity is important. And even now, if for all remember, cancer sits in that framework of non-communicable diseases. And we don't speak about that framework enough. I think we are, look, I think 60% of our deaths from in Belize from non-communicable diseases, cardiac, diabetes, and so on. And now we have an infection. We started out a century ago with infectious diseases. Through vaccines and public health measures, we brought those things down. Although you have outbreaks all over the world, brought it down. And now we have the pandemic again, an infectious disease that's limiting our access
And
to wellness cares.
these very same populations.
That's right. And so we have, it's like a double whammy, literally. And so it's very important to understand that we have limitations in terms of how we can go in for wellness checks. But that conversation must begin because we are having people who are now, their diabetes will be worse, their pressure will be higher, and their PAPs, they're not afraid to go in for a pap smear, and their cervical cancers will increase. Look, we have a lot of cancers per year, you know, new cases. I think in 2010 we had, 350 or 360 new cases. We had 57 breast cancer cases just from the BHIS. That does not include from private sector.
Or people who access care outside of
Exactly, and we've had deaths, so lots of deaths. So it's very important for us not to take on this issue of stigma. We still have people who are, afraid, and all of us are afraid of entering a health facility now, but we have to take care of our bodies.
I can't, you know, because I've not walked in the shoes, so I don't know. But the idea of stigma for some of our illnesses that we have, like cancer, or even with COVID, some people are scared to talk about COVID.
No,
it's one of the things that can really.
It's part of human behavior, really.
But I want to, let's bring this, I think, to a proactive point. I know that we can talk about the severity of cases you're seeing, Dellone. We are blessed to have access at the Dangriga Cancer Center and now the oncology unit at KHMH, where people like Chelsea coming out, a young face, reminding people that even young people can face the consequences of a cancer diagnosis. And I know the Cancer Society has been working behind the scenes helping patients. But let's talk about those people at home who've done nothing to check their bodies, who've not gotten a pap smear, don't know about a breast exam, refuse to do a prostate exam. The list can go on and on. What do we say to people about what we can do to prevent or detect early cancer in our bodies?
Well, I think that we perhaps have to do what we're doing now. With COVID, we have to be deliberate about taking care of ourselves. And we have to do everything because there's some cancers that come no matter what you do. That's what happens. And so we've got to do the right thing for our bodies. And I challenge us as individuals in our homes to really take personal responsibility and really throw aside that little thing that says, I don't want to know. Because, you know, we Creole.
If I don't know, in a hurt
Well, it does.
That's what you say, right?
We don't want to know. So I enjoy myself. No, I don't want to know. But then you get sick. I think it comes with personal responsibility. And of course, the services are there. The Cancer Society is always ready and willing to share information and preventative measures, but focus on prevention. What vaccines are there that you can have for your child? I was very happy to learn from my daughter-in-law, for instance, that my 10-year-old granddaughter had already received her HPV vaccine. And I look forward to the resumption of that service to nationally,
Yeah.
because our children need that in terms of the prevention of cervical cancer in later years.
Yes.
And so I don't know how Dellone feels, but I think we've got to prevent, we focus on nutrition, good nutrition, checking our breasts in the mirror, reacting at the first sign. We don't take, and our sexual health, you know, really making sure we limit our sexual partners. If we have a vaginal discharge, bleeding from anywhere, it's abnormal. Don't
Yes.
take things for granted. And the big thing is for breast cancer, it's not only self-exam, and that's very important because that's how many lumps are discovered. But if you have a nurse or a physician that you can see, a clinical breast exam at least once a year will help you.
Yes.
Right?
And for you, Dellone?
I have to echo positively what Laura just said. In addition, however, we have to acknowledge that we have to come back to the conversation of access. To do proper breast health, you have to have proper access to diagnostic tools.
Yeah.
Correct.
And in many of the regions of Belize, for instance, in some of the regional centers, sometimes the tool works, sometimes it doesn't.
Oh, wow.
I mean, you have, if you do a clinical breast exam and there's something suspicious, you want to send that patient for a further diagnostic evaluation. The regional centers may or may not have the capacity to do mammograms.
That's right.
The burden of having to send a patient to a center where they can do a mammogram might be cost prohibitive to that patient. I would say that in order to help our preventive effort, we need to have open access to those diagnostic tools that can help us to identify very early if something is going wrong. I would say to the Ministry of Health that the communities need assistance to what I call plus up the measures for diagnosis and early detection in each of their regional facilities. Not necessarily the community, because the community facilities feed into the regional centers. But if you have a regional center that can give you a mammogram, you can get an ultrasound, you have physicians that have adopted clinical breast exams as part of their visits when you go there, that will ask you when you go to the pediatric unit, has your son or your daughter gotten the HPV vaccine? The providers need to help, because the individual person needs that support, needs that reinforcement, needs that intentional conversation, okay, about, did you do this? Did you remember to do that? How are you feeling? You know, is there anything that you want to talk to me about that you feel anxious about? This conversation encourages individuals who may be afraid that they have a person who is willing to listen to them. And that begins the process of identifying if something is going on, and that you know that confidentially someone is going to shepherd you through the process, because the public health process is very daunting to a lot of individuals. And you need easier navigation, and some of that is provided by the guy that you're talking to, that you call your doctor, who is interested in making sure that you have the kind of support that you need to sustain good health. Okay, that I would say that we really need now to look at how do we improve this partnership with the Ministry of Health, because they're the ones that they have the most centers across the country, and therefore they have the ability to open more access to individuals who ordinarily don't have access right now.
And to integrate care.
Yeah.
It's an issue of integration, you know. Once you enter the clinic, you know, they ask those like a checklist.
Yeah,
Have
like
you
how
had
they
this?
check
Have
your
you had that?
pressure.
Have you,
Right.
in
Yeah.
addition to pressure,
Yeah.
you had a pap, you did,
Yeah.
you know, and pick up on those things.
Understanding
Because you
all
might
of it.
never see that person again. So you've got to, once that person enters that door, you've got to do this comprehensive assessment.
Well, we have to close off the conversation. I know
Yes.
there's so much more that we can talk about,
Yes.
but we are so grateful that you came in to tell us about the state that we are in right now. I know that your organizations both need support all the time.
all the time.
So we can do that final call. Of course, how people can help the Cancer Society and the Cancer Center.
Yeah, so, Dellone, you didn't say anything about the expansion of your services to Belize City, but we'll come back and talk about that another time. But please, we need support, human resources as well as financial resources. And Marlene, thank you all for having us. And if you know, we need a good PR. So if we, maybe we can get volunteers from your organization to help us document some of our stories.
Yes.
That would be wonderful. I just want to ask everybody to be safe and want to thank all our amazing donors, including those special donors that we will do a special sit down with you on, who
Okay.
have provided hundreds of thousands of dollars to put in an extension of the Belize Cancer Center at the
People can
clinic
get treated here, yeah.
So, and that's that story that will be coming up in probably 2 weeks, 2 or 3
Nice.
weeks.
Nice.
So I just thank everybody. I want to really ask you for your financial support. Everything that comes to the Cancer Society, the resources go into providing services or maintaining the office of the Belize Cancer Society.
Yes. All right, well, ladies, go ahead.
No, I just want to thank you, Marlene, for the opportunity to have this conversation with not only with our colleagues that are aware of the fact that we are here, but also, I mean, Chelsea, it's just lovely to see you.
Yes,
Always
it's so
lovely
pretty.
to see you. Absolutely, and you know, you're a beautiful survivor. And I hope that you continue good health and that you continue to encourage others, you know, to join you in some of the awareness activities that you initiate in your community.
Thank you. Thank you.
All right. Well, thank you all for joining us. We do hope that people have at least latched on to the idea that we must start paying attention to our body, take the initiative to get tests where we can, and ensure that we at least know whether or not we're at risk for cancer.
Certainly.
Thank you so
Yes.
much. We're going to go ahead
Very
and take a break, and I think you have actually set the background for our next conversation. We have with us in studio the makers of Fuse Bistro Organic Products. So all about healthy food that should be delicious. We'll tell you after the break when we have that conversation with them. So please stay tuned.